Hi, my name is Len Dobrin. I'm an endocrinologist in Mountain View, California. The reason for this video is to describe why I think Armour Thyroid is an appropriate treatment for hypothyroidism in a small number of patients. The reason I'm doing this video is because I think that most people haven't got this figured out correctly. I would like to state at the outset that I have no relevant financial interest in the manufacturer or manufacturers of different thyroid hormone products. I have been in practice for 30 years, and I have learned a few things. Basically, I've come to the conclusion that Levothyroxine, which is Synthroid, and a few other name brand manufacturers and multiple generic manufacturers, has a small amount of contaminant in it that makes a small percentage of people feel poorly. The most frequent symptom that I see with this is an achiness and a fatigue. And the achiness seems to be in the shoulder girdle mostly, but not entirely. I have seen people with specific other problems, such as headache or other intolerance. In each of these cases where it is a problem for the patient, the symptom is relieved by stopping the synthetic levothyroxine for a period of 3 to 10 days. And the problem usually recurs within a few days of resuming the medication. I'm going to describe one case that is a striking example of what I'm discussing. 2 or 3 years ago, a woman came to see me. She was in her 50s for a medical problem. I took a history, which included medications, and she mentioned that she was taking levothyroxine. And I also, in the rest of the history, got the response that she had a problem with fibromyalgia. So I asked her, how long have you had fibromyalgia? She said, about 22 years. And I said, how long have you been taking levothyroxine? And she said, about 20 years. And I said, do you think that your fibromyalgia symptoms started before you started thyroid hormone? She said, in fact, she did not know. They were both 20 plus years. She said that when she was a young woman, that she used to be very energetic, and she used to go hiking in the hills behind Stanford, for instance, on a regular basis. But over the last 20 years, she's been unable to do so. She's felt she hasn't had much energy. She can get through the day with her job, but she had no energy to do anything after work. So, besides the other problem that she came to see me about, I said, there's a small percentage of people who feel better on Armour Thyroid than levothyroxine. And let's see if it works for you. So I suggested that she stop her levothyroxine, she get Armour Thyroid, and I made a very rough estimate on the dose. I said take so much twice a day, and in 2 weeks see if you feel any better. If you feel better, stay on the dose, get a TSH blood test in 2 weeks, get a TSH blood test in a month, and call me for adjustment of the dose. Well, I didn't hear back from her. And then I lost track of exactly who she was because I had only seen her once, and I don't remember people's names that well. Well, about 3 months later, I get a blood test, and I realized it was her. And oh my God, the TSH was 50. So I figured either she's not taking her thyroid hormone of either type, or I grossly underestimated her dose. I got her chart, I called her up, and I said, what's going on? And she says, I feel fantastic. I've got all this energy, I've gone hiking in the hills behind Stanford again, I feel fantastic. I said, actually, I've completely undertreated you. She says, I feel fine. I said, well, actually, you need more thyroid hormone. So I increased her dose, and subsequently I've gotten her TSH to 1.2 approximately, and she continues to feel better. So this is an example of somebody who I think has really an intolerance of something in the levothyroxine. Now, what happened with her was that she took the prescription from me, and she went to her pharmacy, and they did not have the Armour Thyroid in stock. So she just stopped the levothyroxine, and over the weekend, it was a couple of days till she got her prescription, she already started feeling better, even before she started the Armour Thyroid. So this makes me think that the levothyroxine had something in it that she wasn't tolerating it. It wasn't a matter of not having enough T3, because she hadn't even started the Armour Thyroid, and she was already feeling better. When she took the Armour Thyroid, she was grossly undertreated, and she clearly felt much better. So I think the problem in many cases of not feeling well on levothyroxine has nothing to do with T4 alone in the levothyroxine and not enough T3. I think it has to do with something that's toxic in the levothyroxine and a small percentage of patients don't tolerate. In other cases, I've had people who felt fatigued and they didn't feel better with taking thyroid hormone. We've tried giving Cytomel or T3, and they pretty much don't feel better either. So I don't think that T3 is the problem. Now I must say that the placebo effect is very strong, and that there are people who are very suggestible, and you say, you will feel better on this preparation, or I think you'll feel better on this preparation. That initially a larger percentage of people report that they do feel better on it. But over a period of months and years, a lot of these people really don't feel better, and they can go back to levothyroxine and really not feel any different. Now, I have also had patients who have had improvement with changing from the ordinary levothyroxine preparation to the newly available Tirosint, which is reportedly a more highly purified levothyroxine with less excipients. It's a low temperature process in making the pill, has no coloring agent, and I would say that half or two-thirds of people who are intolerant of the levothyroxine report that they feel better on the Tirosint. So I think that people who are taking levothyroxine for treatment of hypothyroidism and they feel fine, they don't need to take Armour Thyroid. I think people who are not feeling well, it's worth a trial, and if it helps them, it's worth taking. There are certainly advantages to taking levothyroxine. It is much easier to take once a day rather than the Armour Thyroid, which has both T4 and T3 in it, and the T3 has a short half-life. So it's better to give Armour Thyroid twice a day. You give the levothyroxine once a day. It's got a very long half-life. It's available in 12 different sizes. It's more easily adjusted. So I don't think that everybody needs to be on Armour Thyroid. Only people who have demonstrated improvement. And I think even because it's a lifelong medication, it's usually worth a re-challenge on the levothyroxine if they feel they're doing better on Armour, to see if they really did feel worse on the levothyroxine. I certainly have about 24 patients in my practice who meet these criteria. I think that it's maybe 1 to 4% of the population who are taking levothyroxine actually would feel better taking Armour Thyroid, in my experience. Corollary to this is I've become very sensitive to patients having intolerance of other medications. For instance, somebody comes in, they are on metformin for diabetes, and then they get a different manufacturer. Their pharmacy plan changes or something like that. And all of a sudden they've got some other symptom that is not a typical adverse reaction to metformin, let's say. Or I've had an experience with amlodipine as well, with changing manufacturers. And going back to the original manufacturer or changing to a third manufacturer has solved the problem. And I think as physicians we really need to keep our eyes open for these things because, let's face it, not everybody is the same. And there are excipients or impurities in medications that we have to keep an open mind about. And that's it. Thank you.